Welcome to UO Today. I'm Steve Shankman, Director of the Oregon Humanities Center. Our first guest today is Susan Verschere, instructor in Human Physiology and Director of the Post-Professional Athletic Training Graduate Program. She is the 2008 recipient of the Ersted Award for Distinguished Teaching. She earned her BS at York University and her master's and PhD at the University of Oregon, and she started teaching at Oregon in 1999. In addition to sports medicine, she's passionate about teaching, which has led her to develop innovating teaching methods and materials, which we're going to learn something about in this interview. So, welcome.
Thank you so much.
It's great to have you here. So you lecture to at least one of your classes. You mentioned when you got the Ersted, it was in a seminar, but you're legendary for your 100 to 20 to 200 size classes in anatomy, and you really engage these students. And I'm sure there are a lot of professors out there who would like to know your secrets. Will you divulge some of them for us today?
Absolutely, especially because none of them are truly secrets. But yeah, I teach 2 anatomy classes that are in the range of about 250 students. And I think that the main reason why not only are they not daunting to me, but I think less daunting to the students, is that we do try to do as interactive an environment as possible. And I know that most people think interactive, 250 students, how do these two things match up? But I think that I've found that one of the secrets, per se, for having a lot of engagement in students, even in a large lecture hall, is to really help them to have a way to prepare. I know that most of us have had an opportunity to be in some sort of a large lecture or presentation elsewhere, and you can only be a quiet audience member when you really have nothing to contribute. If this is all new material for the first time, then it's difficult to ask students to participate. That's a lot more scary than if students feel like they have prepared ahead of time. So I would say one of the things that I like best about the environment we've created in anatomy is that students come in with knowledge, and they do that by a homework assignment that they prepare before every class. And it's more than a homework assignment, although that is the way it functions day by day. But the students actually create this resource guide, what I call their anatomy resource guide, and I provide a skeleton outline of the content, and then I say, come to class with what helps you to understand that content. So some of them draw just amazing pictures, some use the internet to gather visual resources, some write about it. But when they walk in the door that day, it's not a question of what are we talking about today. They walk in the class saying, okay, well, here's the information I'm ready for. So then it gives us the opportunity to ask a question and have lots of people have answers because they're prepared. And so, I know that's different than some other large class environments that students have been in, but they, it seems to me, quickly can switch gears and engage into this large lecture process. So I've enjoyed that quite a bit. Yeah, and so they spend a lot of time talking to me and talking to each other in the class.
So let me ask you, first of all, how do you, with the classes that large, how do you ensure that they're actually doing the homework? Doing the homework.
Right.
Yeah. What are your...
And believe it or not, I collect homework from 250 students. And a lot of people think that's also a little bit crazy, but with a system, almost anything can work. So it's actually a fairly seamless system now. There's 6 places around the classroom at the beginning of class where they can pick up homework from the previous day, and then we go and start the class. And at the end, we put out 6 new folders, and they hand in the next that day's homework. And I'm lucky enough to have a large cadre of undergraduate TAs that have become engaged from previous years and want to get more involved. And so I feel that really helps a lot to have their support. So I have about 6 undergraduate TAs that then help me to manage looking through that many students' homework. So then it ends up working, and believe it or not, students thank me often for making that homework required, because so many of them say, I see the value of this, but man, it would be hard to prioritize each and every day without it being a mandatory part of the system. So I felt really good about that, knowing that they're getting a lot out of it, and it's not trivial. They put a lot of work into their homework assignment, creating this external, I call it their external brain, which the idea being that our computers often have an external hard drive to help support the amount of memory they need. Well, we sometimes need an external brain because the one we carry around with us in our head can't always contain all of the details we need at all times.
And so what is the external brain then in terms of the students?
So the external brain is the name of this collective homework assignment. So they are creating their external brain. So this is going to be their resource guide. But every day they do another part of it, and that goes into their book, and they do another part, and that goes in. And so class by class, they build their own anatomy resource guide that we call their external brain.
Okay, so that's how you get them to participate.
Right, so they have it right there in their hands.
They have it in front. And what about in class itself? Do they speak, or do you lecture most of the time?
Absolutely. So so the typical format would still include me standing in front of the class and having a PowerPoint, but as many times as possible, the PowerPoint is a question instead of an answer. And so because I know that they're sitting there with information that they've already organized and done a lot of work on and brought to the table, then I can ask them questions and they have answers. So, you know, for example, if we're talking about the skull, I can point to different areas on the skull and say, can someone tell me what is the name of this foramen and which cranial nerves passes through this? And they'll answer because they're ready to and they have that information. And so instead of it being only a delivery type of lecture, it's really a question and answer back and forth. Only I'm asking the questions and they're providing the answers.
So, if you could just very briefly, I'm sure you reflected on this. What makes a great teacher? Just very briefly, what is it?
That's a good question. I've read a couple of books that have really tried to ask that question. And thank goodness for them because they've helped me get closer there. You know, I would say that I'm moving more towards the direction that a great teacher is not about their techniques. It's not necessarily. You can't give someone technique and say, this is a great teacher technique, go do it, and they will become a great teacher. I really think it has a little bit more to do with what their identity is and what their integrity is and how those match up with what they do in the classroom. So I think it's finding the right balance of understanding yourself as a teacher and understanding what you value, and then finding the techniques that mesh with that. I think that's what we recognize when we go into I know that we've all taken classes where we can say, wow, that was a great class and that was a great teacher. And other times it'd say, yeah, it wasn't really. And you know, people have been trying for so long to tease apart what does that mean. And I just recently read The Courage to Teach by Parker Palmer, with the Teaching Effectiveness program here on campus. And that really helped me to identify why you can't give techniques to people and they'll just become instantly great teachers, because there has to be a matching up of these integrities and values.
So
with
integrity,
techniques.
value, what else did you say?
Yeah, so well, I think of sort of the integrity of the person and then just their identity. You know, how do you identify as a teacher? How does that fit into your understanding of yourself and how you identify within yourself, but then how you also identify the role of the student. So you have to get all of those things to come together. And I think what students sense when things aren't going well is when there's a mismatch. You know, what the person's saying doesn't really seem to match how they, you know, they might say this is what they value and this is what they say is their integrity, but then their identity doesn't match that. So I think it's the coming together of all those pieces. And so for me, my path towards that has to do with respecting the students, understanding that I'm here as a service to them. I'm not here for my own glorification to stand up in front of a group of people and explain to people how smart I am. I think that actually is what tends to lead us away from good teaching, because teaching is about learning. So a great teacher would be one who creates great learning experiences. You know, so I think it's just turning the table a little bit and not thinking of yourself as this being of higher knowledge who can deliver. My integrity leads me to, and my identity leads me to a type of teaching where I want the students to be the ones that are in the you know, at the top of the pedestal or in the front of the spotlight, and then just provide environments where they can be supported in their learning process. And with 250 students, I recognize that's a lot of different people's learning processes that I'm trying to support and balance. But I think once students recognize that that's how you feel about the process and that is your identity, they can then connect with it and understand their role and how they should behave and how they can get the most out of it.
Well, that's very, very articulate. I'm glad we got those reflections on camera.
Thank you.
In the few minutes we have left, I'd like you, because you not only are a teacher, but you do research as well. Tell us something about well, your work on athletes has drawn national attention. You were recently on a National Geographic program. You want to tell us something about that?
Sure. And my current role is actually mostly instructor, and the research I do is really just to support graduate students. But the fun things that I've done in the past that have gotten a lot of attention is about sports bras, if you can imagine it. So I did some biomechanical testing of sports bras, in which I looked at different designs and helped to move us further down the line of understanding which designs of sports bras will help larger breasted women exercise effectively and comfortably. And so on the National Geographic Channel, they had an episode where they wanted to include a segment about how does one do this type of testing, and how does biomechanical testing take place, and it was an enjoyable experience to get that message out that here are some designs that women should look for that are specific to the ability for a larger breasted woman to exercise. So I certainly hope a lot of women see that and can take that advice and then go and be successful and exercise.
Good, thank you. And also, you've also researched female sports injuries, I think, as well. You want to, in about the minute we have left, you want to say something about that? Yeah,
certainly. So I looked into the issue of why women tend to tear their anterior cruciate ligament, their ACL, more often than men. And there's a large group of researchers out there trying to answer this question, and we have not found the answer yet.
I didn't know that was the case.
Yeah, so it is the case, especially in sports like basketball and soccer or handball in Europe. And so there's a lot of different factors. It could be hormonal or biomechanical or neuromuscular. And I looked at the hormonal angle to see if we could just help add a little bit to that puzzle of trying to understand what's happening with women in ACL injury. But we have a long way to go before we have definitive answers. And so women should definitely keep doing all the exercise they're doing. It's just, we're just trying to figure out, what is it that makes them just at a higher risk than maybe their male counterparts.
Well, thank you for sharing that with us, and thank you for being with us today.
It's a pleasure. Thank you so much.
We've been speaking with Susan Verschere, Director of the Post-Professional Athletic Training Graduate Program and instructor in the Department of Human Physiology. We'll be right back. Welcome back. Our next guest is Dr. Tom Ryan, the Prevention and Preparedness Coordinator for the University of Oregon. Tom Ryan earned his BS at the College of William and Mary and his Doctor of Medicine at the University of Virginia School of Medicine. He has spent most of his medical career in university health centers, either as a staff physician or as the director of the center. His current assignment is to perfect a pandemic emergency plan as part of the university's emergency management program. Well, we're sorry to take time away from your urgent work here, but tell us, it's great to have you with us. Is there something you're particularly worried about at the moment?
Well, I guess I would say first, we're probably not going to perfect that plan, but we're really working on a plan for pandemics. And I think all of us are aware that there's a lot of news about avian flu, the H5N1 virus.
Excuse me, just pandemic as opposed to epidemic. You want to just
talk a little bit
on the language, and I'm sorry to interrupt you, but then go ahead. Yeah.
Sure. Yeah. Every year there are seasonal epidemics in the U.S. of influenza. About 5 to 20% of people get sick. Around 200,000 are hospitalized, so not a minor event. About 36,000 people die. That happens every year. There's a vaccine that's available for it. Most years it works pretty well. This year it was off a little bit. I think many of us have read about the fact that a new strain appeared after the vaccine had been developed that ended up causing about 50% of cases this year. But vaccine is available, and it's the best way of preventing the seasonal flu. A pandemic, on the other hand, there are three things that are required. Pandemic is caused by a novel virus, so a virus that hasn't circulated in humans previously. Virus needs to be capable of causing severe disease in human beings. And then thirdly, the virus needs the capability of being transmitted easily from person to person in a sustained fashion, so person to person uninterrupted, which takes us back to the H5N1 virus, which is a novel virus. It is not currently circulating in humans. We have no immunity to it. It's capable of causing very severe disease. There have been about 342 cases that have been reported since 2003, and over 60% of those infected have died. So capable of causing severe disease. Fortunately, it is not able to transmit from person to person easily. Clearly can be passed from infected birds to humans, but doesn't happen easily, and if it does happen, it does not pass from one person to another easily at all.
So again, would you like to contrast epidemic and pandemic? What would be
Well, the pandemic, again, is it would have the potential of causing a severe disruption. The epidemic flu, in the scale of things, causes a relatively minor infection for most healthy people. People who have underlying diseases, or like you and I, are over age 50, may be at higher risk of complications, but in general, it doesn't cause a major disruption.
I see.
A pandemic, on the other hand, has certainly the potential of causing that disruption. We can think back to the pandemic of 1918. 675,000 deaths in the U.S., 50 million worldwide. Huge disruption, of course, right in the middle of World War I also, but just totally stood society on its head. And of course, that particular virus seemed to have a penchant for causing infection in young, healthy individuals. People between 20 and 50 were at high risk of complications and even death as a result. Having said that, and I guess before I go further, I would say that that's the type of pandemic we're planning for.
I see.
But having said that, there have been two other pandemics in the 20th century, one in 1957, another in 1968, far milder. The worst of those, perhaps less than 70,000 deaths, and certainly I don't minimize that, but compared to 675,000 deaths, a huge drop. The more recent one in 68, really 34,000 deaths, so a much milder pandemic. So we feel that by planning for the worst, it gives us the flexibility to scale back. We can always pull back and say, we don't need to roll out all of these things we have planned for. Much harder to gear up and say, oh my gosh, we weren't ready for this.
Exactly. So it's been 40 years, though, since there's been a major pandemic in the United States.
Yes, yes.
So the title of Prevention and Preparedness Coordinator, how long has that position been around? And tell us something about what's entailed in your duties.
That's a good question, and actually it evolves as we go along. Emergency management in general is new at the university, and I guess to look at emergency management, it's really a profession that's in its infancy. Emergency management in communities, and certainly the University of Oregon is like a complex community. In the past had been delegated usually to fire department, police department, perhaps public works or environmental health and safety, but it was folded into, it was another job responsibility of somebody who already had a full-time job. And I think that events, particularly in this century, 9/11, Katrina, those types of things have really clarified the need for planning that moves beyond response. And so what we try to do in the emergency management program is create an environment where the university can really assess risk and determine the best ways of reducing vulnerability to those risks. And that really involves pulling people together from all over campus. So I think one of the critical things for all of us who work in emergency management is we don't do this by ourselves. What we really do is facilitate and coordinate and bring together people who have different perspectives and can look at a specific hazard or emergency and determine how that's going to affect them so that we can develop plans that are comprehensive and campus-wide rather than just sort of narrow in their focus. The other thing that we try to do in emergency management is move beyond that response component. Critical. I mean, that's the sort of, here's the emergency, what do we do and how do we do it? But there are other steps that are involved. There's mitigation, which is sort of designing strategies to reduce or prevent loss. There's preparedness, which is developing these plans and developing capabilities to be able to respond to emergencies. There's response, a critical component. And then there's continuity of operations and recovery, which is certainly one of the things, I think Katrina perhaps highlights that pretty well, that there's the emergency, there's dealing with that, but then how do you bring things, how do you continue services during it, and how do you bring things back online afterwards? As far as my particular position, I think we share our responsibilities. There are three of us who work percentages of time in emergency management, and we share responsibilities. Most of my responsibility is related to infectious disease planning, simply because that's my background and expertise, but also outreach education, developing printed materials and other materials and doing presentations. Thank you for the opportunity to get the message out. And then working in conjunction with everybody else to support the efforts of emergency management, which runs across the scale from disasters to, for instance, getting ready for the 2008 Olympic trials.
Yeah, I was going to ask you about the kinds of things you prepare for. I mean, not to alarm people out there, but what are the kind of things you're preparing for? Because we think about earthquakes around here. We think about, of course, now just these terrible, in China, and then we have these tornadoes.
Yeah. Sure, and certainly we look at all of those things. We look at earthquakes because we know that we're at risk of earthquakes here in Oregon. We sort of read the news about the bulging on the side of the Sisters, and of course there's the San Juan de Fuca plate, the Cascadia subduction zone. There are all these, it's an active area in terms of earthquakes, so there's a potential for that. Fires, windstorms, ice storms, hazardous spills.
And you go through all these different scenarios?
Basically, at its base, and not being a professional emergency planner, so I've certainly studied a lot since I've moved into this position, but what you try to do is assess risk and vulnerabilities. And so what you do for any community, including the University of Oregon, is say, what sort of things might affect us? We're probably not at much risk of having a tornado here. Could happen, but the risk is very low. Higher risk of having a earthquake, pretty fair outage, likelihood that we could have a significant power outage related to an ice storm or windstorm. So we try to assess risk. We try to determine the likelihood that it's going to happen. And then we try to put planning together to bring those groups together to work collaboratively, determine how best to respond and react to that.
Well, unfortunately, we're out of time. We didn't really get to talk to you in much
shoot.
detail about your about your own expertise, but we welcome you back to the program another time.
Yeah, I'd look forward to that.
Thanks for being with us.
Yeah,
We've been speaking with Tom Ryan, the Prevention and Preparedness Coordinator for the University of Oregon. Thank you for watching.